Hi, my name is Daniel Ray. I'm Director of Informatics and Patient Administration here at University Hospitals of Birmingham Foundation Trust. On all my historical video diaries I've always shown some sort of system or reporting tool. So what I'm going to talk about and show today in this particular video diary is the Trust Clinical Dashboard that we've developed. It's actually been used across the Trust for about a year to 18 months now. It brings together data from a number of different systems, which I'm going to show you, into one place. In the last 18 months since it's been launched, we've had 32,000 logins from 1,200 unique staff. That doesn't include any information people, of course, in that. This is our clinical dashboard with all the different dials, so you get a ward view that you can select in this top left-hand corner. So I've just picked a ward at random. Here we've got dials and two lines on here, two needles if you like, one showing the trust and one showing the ward performance. We've got back to the floor visits that are done by the senior nursing staff. Over here we've got the dependency of all the patients that's fed through from PICS. You can jump to a live bed management tool, which we've shown on a previous diary. You can click here for a walkthrough, so you can watch the mouse move around, how you can actually use the tool. So what data have we got in here then? We've got patient feedback. So this is fed back via the TVs, the handheld wireless devices. And here you can see we're up around 50% of all inpatients going through this ward feeding back. We've got omitted antibiotics, which comes from our e-prescribing solution. We've got omitted non-antibiotics, delays from time prescribed to first administered. So again, this comes from PICS, our e-prescribing solution. Just scrolling down, we've got falls, red lines, patients haven't been discharged, omitted nutritional supplements, type in doses, which is where drugs are typed in that aren't selected from the formulary, so the rules base won't work. We've got the usual infection bugs, Acinetobacter, C. diff, MRSA. We've got complaints as well, feeding through into here. We've also got reported incidents, average length of stay, pressure ulcers, and also smart sickness, so the actual staffing levels, number of episodes from the staff that have occurred on the ward. So you can see all this data coming through in one place. It's all updated at least every 2 days, and some of it's live, so that's the longest that it's out of date. And then the most important element is at the bottom, and these are all the thresholds of all the points as to what does red and green mean, and all of this has been set by the nursing staff, not information staff, which is really important. And then underneath you'll see the blue links, which basically take you down to a lower level for drill through. Each one's different, so patient experience feedback takes you into food, attitude, cleanliness, etc. Breakdown. The length of stay takes you to just see a trend graph over time. And the omitted antibiotics, if you just click on this, goes to show right down to the actual prescriber, who is due to chart the drug, which we've got here, who is due to chart it, what the drop down reason was, who the prescriber was, and the total number. And then you've just got more higher level information at the top. And you can drill through again down further there to see actual drugs. So each drill through and dial is separate, which again has been set by the nursing staff. The other thing that we do is each week the computer calculates the points off each of the dials here. So each of these dials have been weighted in terms of importance by the nursing staff, and it multiplies the actual score for each ward by their performance, which is then sent to the nursing management teams and the chief nurse, who can then drill in again and look to see what the performance is of each of the different wards. So you can see it's quite a key system that brings lots of different information together in real time for the wards and the nurses to access.